Our drug industry has been disastrous. They're leaving left and right. They supply our drugs, but they don't make them here to a large extent. And the other thing we have to do is create new bidding procedures for the drug industry because they're getting away with murder.
Well, strong stuff there from the president on the high cost of drugs. Joining us now, the former president of Lilly USA, that is a drug company, Alex Azar, is with us this morning. All right, Alex, you've seen the Senate's new plan, healthcare plan. Does it lower drug prices?
Well, Stuart, there's nothing in the Senate bill that directly lowers drug pricing, and that's really not the intention of the legislation. But there's something in there that I think will have a positive effect on drug prices, which is one of the many taxes in Obamacare was a prescription drug user fee, an excise tax that basically every pharma company has to pay. $27 billion of taxes over 10 years. That goes away in 2018. That creates several $billion of bottom line space that can allow drug companies to moderate price increases that they otherwise would have taken to meet bottom line requirements for their shareholders.
Okay, interesting. I've got another one for you. Senator Rand Paul, he opposes this new plan. He's concerned about the subsidies in it to the insurance companies. Roll tape.
Conservatives want a repeal bill. I want a bill that looks like, feels like, and is a repeal bill. My fear is that when I look at this, I keep reading it, and it's like, it sounds like Obamacare to me. It doesn't even sound like Obamacare Light. In some areas, it may be Obamacare Plus on the subsidy side. We can't have a bill that spends more than Obamacare in the first couple of years and call that a repeal bill.
Okay, he says he's concerned about the subsidies going to the insurance companies. What's your response to that?
So tremendous respect for Senator Paul, but the simple fact of the matter is that we do not have, for better or worse, 50 United States senators who believe like Senator Rand Paul believes. There are not 50 votes to completely repeal Obamacare. You've got Susan Collins and Lisa Murkowski holding down the moderate wing of the Senate right now, Senate Republicans, who basically are objecting to anything in this legislation that isn't a repeat of Obamacare. So it's just not going to happen. And so Senator Paul and Ted Cruz and Ron Johnson and Senator Lee are going to have to decide, are they willing to accept a package that isn't full repeal, but is the largest restructuring of an entitlement program in the history of the Republic, Medicaid, that reduces the amount of subsidies going to individuals through the Obamacare program, has $1 trillion of tax cuts in it, creates small business association health plans, increases deductibility of health savings account contributions to more equalize them to people who have employer-sponsored insurance, and are they willing to walk away from that?
You're sold on it. I mean, you're gung-ho for this plan, aren't you?
Well, listen, I'm not here to advocate support of the plan, but my goodness, compared to the status quo, it's lower taxes, less regulation, lower premiums, more competition, and a more stable insurance market than what we have now. Is it perfect? It's certainly not, but my goodness, what we have now is not working, and it's not sustainable.
Just a technical quick check for a second. In my opinion, the subsidies going to insurance companies are going to them so that you don't have a sudden spike in premiums when Obamacare is ended and the new system begins. Have I got that right?
Yeah. You've got it absolutely right, Stuart. You've got a short-term and a long-term stabilization fund, $50 billion in each, that go out to the insurance companies through the states. And the idea is first to create high-risk pools so that the states could create mechanisms to pull your sickest beneficiaries out into those high-risk pools and reduce premiums for everybody else. And then also so that states could create stabilization of premiums as you have this disruption. What is health insurance? It is an actuarial business to predict the future. When you're in a time of uncertainty right now, you will have change, and the government steps in through mechanisms like these subsidies to create a stabilization until you know who your beneficiaries are, who's in your risk pool, so you can create a stable underwriting. That's what it's about.
It's politically necessary, actually. Alex Azar, always good to see you, sir. Thanks very much indeed. Appreciate it.
Thanks, Stuart.